The CDC and FDA are discussing whether higher risk groups, so elderly people or people with compromised immune systems, should get yet another booster. I think it's very clear there's not going to be a recommendation for healthy adults, healthy young people to get an additional booster in the near future. There probably will be a recommendation for higher risk groups, elderly or immunocompromised, to get a booster. What's been shown is that in those groups, there's maximum protection for about 4 months, and the protection wanes. So it seems likely in the next couple of weeks, there'll be a recommendation for the higher risk groups to get an additional booster once it's been 4 months since the last bivalent booster. And that we should be hearing about that soon. And where we are in April 2023 is that between the vaccines and between natural infection, we've achieved herd immunity. I think 98% of Americans have either had one dose of vaccine or have had COVID. The other, COVID news is that the public health emergency that started under President Trump has continued under President Biden is going to end no later than May 11th. So what does this mean? In the short term, it may not mean a lot for everybody. Eventually, medical care related to COVID will be like medical care related to any other condition. So vaccines will no longer be free. There may be vaccines in the pipeline. So even after May 11th, they still may be accessible. But eventually, getting a vaccine for COVID would be like getting a vaccine for other conditions, sometimes covered by insurance, sometimes a copay, that sort of thing. The medications that we have to treat COVID, and particularly popular, of course, is Paxlovid, which has been very effective. That's currently free. And eventually, after the public health emergency is over, it may no longer be free. And so accessing medicines to treat COVID would be similar to accessing medicines to treat any other condition, sometimes covered by insurance, sometimes a copay, sometimes not.